Are you wondering what's the best sciatica treatment? Well, you're in luck because we are going to talk today about the best treatments for sciatica and what you can do at home right now to help with your sciatica pain. I'm Dr. Amy with Physical Therapy for Everybody, and here at Physical Therapy for Everybody, we are focused on helping you live an active, healthy, and confident lifestyle without needing pain medication or surgery. So this goes right along with our theme of giving you some things you can do to help with your sciatica pain right now at home. So first thing is, what is sciatica? So sciatica is pain that's going down the back of the leg. The sciatic nerve is formed from nerve roots which are coming out from your low back or your lumbar spine. They go down through your butt and then they travel down the back of your thigh. At the knee joint, on the side of the knee, it actually splits into two separate nerves. But most people don't necessarily have pain all the way down into their foot, at least when the sciatica starts. Usually it's more in the butt and the back of the thigh, but as it progresses, you may find that your symptoms go down into your foot. Now, I have had some patients come in and tell me that they have pain in the front of their leg, and that can be a different nerve, but it's technically not sciatica because sciatica follows the sciatic nerve, which is down the back of your leg. So the tips that we're going to discuss in this video might still be applicable if you have pain in the front of your leg. However, they will not be helpful. In the next video, we're going to show you some exercises specifically for sciatica. Those will not work if you have pain in the front of your leg, only if you have pain in the back of your leg. So good thing to know. All right, so now that we know what sciatica is bed rest recommended for sciatica? Absolutely not. And please hear me on this one. This one is critically important. Now, back in the day when I was just a youngin', if you got sciatica or if you had surgery or anything like that, they would usually recommend bed rest for at least a week. That was back in the day. We've done a lot of research since then, and science has told us that we do not want to be sitting or lying down for long periods of time with sciatica. The reason why is that what happens is that all the ligaments and the muscles and everything relax as we're sitting or lying down. And then when we get up and gravity starts pushing down on our head, it makes our symptoms even more painful. So with sciatica, you don't want to be sitting or lying down for long periods of time, other than when you're sleeping, because you guys know what I always say, if you're not sleeping, you're not healing. So definitely, if you're sleeping at night, get as much sleep as you can and don't worry about moving around because it's more important to sleep at that point. But during the day, you need to be getting up regularly and walking around and doing pain-free movements to help yourself feel better, to get those muscles more activated and to get everything working better and less aggravation on the sciatic nerve. So resting is not helpful with sciatica. Again, unless you're sleeping, or unless you're using ice, or unless you're doing something while you're sitting and lying down that you need to be sitting and lying down to do. Although you could strap an ice pack on your back, like that would be fine too. But unless you're doing something specifically, do not be sitting or lying down for long periods of time. All right, does PT work for sciatica? Yes. We have had very great success with patients specifically with sciatica, but you do need to be working with a specialist who focuses on sciatica treatment. If you go to see a generalist, they'll give you a general list of exercises. They usually come on those like pre-printed sheets, right? And they are general, right? So they're kind of general usually for like a low back pain type thing, and sciatica is different than a low back pain thing, right? Because it's down the back of the leg and the nerve is irritated. Low back pain can be for many different causes, and we've got tons of videos of that elsewhere on our YouTube page. But for sciatica, we need a really specific treatment plan. So you need to see a specialist who understands your needs regarding sciatica and not a generalist who's just going to give you low back exercises. Now, the two things that we focus on here at Physical Therapy for Everybody with sciatic treatment. First thing is we want to decrease the stress to the sciatic nerve. So during the evaluation process, we will go through and figure out where along its path the sciatic nerve is getting irritated. There's actually multiple areas that it could be getting irritated, and it may be getting irritated in more than one of those areas. The most common is either at the low back because of one of the discs, most commonly, or it could be because one of the joints is not moving correctly, or in your hip as it's going either under, through, or on top of the piriformis muscle. That's another point where it can get irritated. Also at your knee, we talked about at the knee how it splits into those two junctions. It can also get irritated at that point. Now, obviously, if it's getting irritated at your knee, you're going to be having those foot symptoms. You may or may not be having those at this time, but that is another point. And the thing to understand is that the sciatic nerve it's kind of like a long tube. It's kind of like a hose in a way. And so if it gets kinked at one spot, let's say your low back, like right at the start, sometimes it can also then get kinked at another spot, like your hip, and then kinked at another spot, like your knee. So as it travels down, it can actually get kinked over time at more than one spot at a time. But usually it gets kinked initially at one spot. So that's why we like to treat sciatica just as quickly as we can, because if we treat it when it starts, it's usually only one kink we have to deal with, and that's way easier than having to deal with all three. I have seen patients who have dealt with the sciatica on and off for a couple of years, and it's gotten to the point where basically that entire nerve is just kinked up and has a lot of stress on it, doesn't move correctly, all of those things. And then we actually do have to go through and unkink it from all the different spots. Obviously that takes longer. So I definitely prefer to see people right in the beginning of their sciatica symptoms because it's way easier to get it calmed down initially, and then it's way easier to start that rehab process so that it doesn't come back. So that's the second part of our treatment. We need to increase your strength and flexibility so that this hose isn't getting kinked again. So that can be in your low back, again, it can be in your hips, it can be in your legs, in your lower leg, wherever that kink is happening or wherever has gotten weak because of the kink. We need to work on that as well as the flexibility, because a lot of times the sciatic nerve is getting compression from a muscle or a joint, and that's what's actually causing the irritation to it. So we need to have that flexibility in the muscle or the joint to move correctly. So we're not going to try to get your joints to move more than they should. We're definitely going to work on getting your joints to move only as much as they should. We're not trying to create joints that have too much motion, because that leads to other problems and we don't want to start talking about those. But we do want them to be able to move normally so that we don't get that kink in that sciatic nerve. Does that make sense? Hope so. If you have questions about that, please drop them in the comments below. We love making videos and answering your questions. So if you run into any questions as you run up through this video, please feel free to drop them below. We'll make another video to help explain that a little bit better. So, should you use ice or heat for sciatica? You should always use ice. Definitely for sciatica. Let me explain why. First thing, ice is a huge pain inhibitor, which means it decreases the pain to the area. So now where do you use the ice? On the low back, on the hip? You use it wherever it hurts. And if you need to chase that sciatic nerve all the way down your leg, do 5 minutes on your low back, 5 minutes on your hip, 5 minutes on the back of your leg, 5 minutes down the side of your leg. Have multiple ice packs, be switching them out. All that stuff is absolutely fine. You want to put the ice wherever it hurts. Now, after we do that evaluation and we figure out where the sciatic nerve is actually getting kinked up, we'll have you use the ice on that area specifically, as well as where you're feeling the pain in addition to that. So after the evaluation, we may change a little bit of that plan, but for right now, what you can do at home safely is you can put ice on the area where it hurts. All right, that'll be good. And then if you want to put it on other areas along the path of sciatic nerve, that's fine. But please put it for 5 minutes on the area that hurts every hour, especially when it first starts, because it's really sharp, it's really brutal, and you really don't feel like doing anything else. So go ahead and slap some ice on it for 5 minutes every hour. It's gonna help decrease your pain, which is going to allow you to get up and do those gentle movements that will help to actually heal the sciatic nerve. Now, the reason why I don't use heat. So heat increases blood flow to the area, right? When we're dealing with something that's stuck, like the sciatic nerve, and we increase blood flow to the area, then we're going to increase inflammation. If we increase inflammation, that's going to increase irritation of the sciatic nerve, which is the opposite of what we want. Now, I have some people who have said, well, my piriformis is kinking the sciatic nerve, and I feel like if I use heat that it helps to decrease the tension in the piriformis. And that may be true in the short term. However, probably in the long term, it's actually increasing that inflammation around the sciatic nerve and actually increasing your symptoms. So you want to make sure that you're using ice. Do not use heat, please, specifically for sciatica. It definitely can increase your symptoms in the long term. But ice for 5 minutes every hour on the area where it hurts is going to help decrease the pain enough that you can get up and do some moving around. All right. Now, does sciatica ever go away for good? So the answer is yes, as long as you treat the root of the symptom. Again, the sciatic nerve can get kinked at multiple areas, and that may not be where you're actually having pain. So you need to see a specialist who can diagnose where you're actually getting, where the kink is actually happening, and deal with that. And the reason why, right? Is it a disc issue? Is it a joint issue? Is it a muscle issue? Is it a ligament issue? What's the issue that's causing this sciatica to start in the first place? If you don't heal what caused it to start in the first place, it is going to come back. Even though you may be able to relieve the pain, it's gonna come back in the long term. So to give you this example, I wanted to share with you the story of a gentleman we're gonna call George. So George first came into my clinic and he couldn't even walk down the hallway to my clinic because he had so much pain. I mean, he technically did walk down with a cane, but he arrived at my door red-faced, huffing and puffing because just that walk down the hallway was so painful for him. So we had him lay down on the table immediately because that was his position of comfort, and started talking to him and finding out what was going on with his sciatica. So this was a new flare-up of sciatica, but this was an issue that he had had for years and years, and it would flare up. And honestly, he would stay in bed for 3 days and he would ice, and then it would clear up and everything would go away. But this had happened multiple times over the years. And so at this point, everything was flared up. He had been in bed for 3 days and it had just gotten worse. So his body did not know how to deal with it, hadn't been dealt with years ago, and now it was coming back and rearing its ugly head again. Now here's the thing about George. 6 weeks from the time I saw him, he was supposed to fly down to California and walk his one and only child down the aisle for her wedding. And obviously, this is a big event. This is her father, this is their only child, and it is super important for her and for him that he is able to actually walk her down the aisle. Now, I'll tell you about George. He would have walked her down the aisle if he had to literally crawl. I mean, I'm not kidding you. He was gonna make it happen. But of course, we wanted him to be able to enjoy that day, to not have pain and to not have to worry about this sciatica, and to actually have joy on that day because this is his only child who's getting married. So as soon as I found out, we pulled out all the guns. I actually saw him twice a week for 6 weeks, for the first 6 weeks, because not only did we need to eliminate the symptoms, but we needed to start dealing with the healing, because he was going to have to fly, sleep in a different hotel room. Of course, there were tons of events surrounding the wedding, so there's going to be a lot of sitting for long periods of time and not necessarily the best chairs. So it wasn't just that I could get rid of the pain and he would probably be okay. Like, I had to get him into some of that healing, or else things were going to fall apart on this trip. So I am super happy to announce that George did make it to the wedding, and he walked his daughter down the aisle. He had no pain. Flying, hotels, sitting, eating unusual foods, all the things he was able to do completely pain-free. So when he got home, and he showed me a picture of him walking his daughter down the aisle, he said, now I want to play golf. Now, obviously golf requires increased rotation through the spine, and you also need increased strength through your hips. Now, we had not started working on that yet at this point, because again, our initial goal was healing. We need to get this thing healed so that you can go and do this other thing, right? Walk his daughter down the aisle. So at this point, we switched directions. We really focused on getting him back his full rotation, as well as strengthening his hips. And I am super happy to announce that after he was done with his plan of care, he was able to play 18 holes without any low back pain. So we met both of his goals during his treatment program, although they were different. The qualities that were required were different for each of them, but that's how we changed the plan based on what it is you want to do. And again, I will tell you that George, about halfway through it was about 3 weeks into that first 6 weeks, he was saying, he's like, well, but I want to play golf too, so I want to start working on that. And I was like, no, we're not working on that. You've got a wedding coming up, my friend, and that is the most important thing right now. So we stayed focused on that goal initially, and then we switched goals after he had achieved that one and worked more on that rotation and that hip strength so that he could get back and playing golf. And that's what we do here, is we really figure out the best plan for your body based on A, obviously what's going on, but B, what your goals are. Your goals may not be to play golf, and so we don't need to work on that. We need to figure out what your goals are and what we need to do to get you to that point. So if you have any questions about this video, please drop them in the comments below. Please subscribe to our channel so you can get notified of all the videos that we upload. We try to upload at least once a week, so there's always something new coming out from us. All right, have a great day, everyone. Bye.